Are you worried you might have a cataract? Well, I am going to review all the things you need to watch out for. Yep, that eye pun was intended in this video. Keep watching. I am Dr. Rupa Wong, board certified ophthalmologist, and on this channel we talk about eye health, eye surgery, eye makeup health, and a little bit about my life here in Hawaii as a doctor for the last 15 years. So if any of that interests you, make sure to hit the like, subscribe, and follow along button. All right, today we are talking about cataracts and what you need to be worried about if you think that you are developing one. Is it dangerous? Is it going to cause you to lose your vision? And all the signs and symptoms. Now, I am a pediatric ophthalmologist and adult strabismus surgeon, so I actually no longer do adult cataract surgery. I still do pediatric cataract surgery though. My husband does adult cataract surgery, and you can check out these videos where he did my mother's cataract surgery, and it also includes a video right here of what to expect from the cataract visit and the surgery itself. But before we get to the surgery and the lenses and all of that, let's talk about what is a cataract. A cataract is simply a clouding of the lens of your eye. The lens that sits in the middle of your eye, and light usually goes from the front surface through the cornea, through the opening, which is the pupil, gets focused by both the cornea and the lens, and then focuses onto the retina, which is like the camera film of the eye. That gives it a nice, clear, sharp image, which it then sends to the brain. As you get older, a lot of protein deposits start to clump together, typically because of age or oxidative stress or ultraviolet light, and that's what makes the lens become cloudy. Instead of being clear like a window, it starts to get cloudy like a dirty windshield. In addition to becoming cloudy, it starts to lose its elasticity. When you're very young, your lens can change shape very easily. That's why kids have really great vision. As you get older, you start to need reading glasses because the lens doesn't change shape as well. It loses that elasticity. It gets thicker and gets cloudier. And all of those changes basically create a cataract. A cataract is not a growth on the eye, on the surface of the eye, or even in the middle of the eye. It's simply a clouding of the lens that is already there. So why does it matter if a cataract is a cloudy lens? Basically, as you get older, typically, what happens is then you've got a cloudy, kind of dirty windshield through which light is passing. So the image that is focused onto the retina is no longer sharp and clear, and it starts to get blurred at the edges. Things to look out for. You might notice cloudy vision, blurred vision. You might even have trouble with your night vision. You need a lot of light to read when it's nighttime, or you have trouble driving at night. That's a very popular question we ask everybody. You may even find you are sensitive to light, or that you have a lot of glare and halos, specifically, again, driving at night or during nighttime conditions. And then one of the most interesting things that happens is you start to get a fading of colors. And again, that is because the cataract is getting denser, it's getting more opaque, and actually a very advanced cataract is a little bit yellow. So if you want a little fun fact, Monet actually had terrible cataracts, and you can see this if you look at the transition in his water lilies painting, which he painted like, I think, 100 different versions of this over his lifetime. And you can start to see how disorganized, how blurry, how more impressionistic it looks, but even the color saturation is getting worse and worse as he gets older. Well, he had cataract surgeries. So what they did back then was just take the cataract out. They actually pushed it to the back of the eye. They did not insert an artificial lens in the eye at that time, and all of the colors are brighter. He hated it, and in fact started wearing these yellow glasses to mimic the cataract because he had gotten so used to it. This color desaturation that comes with cataracts, even the clouding and the blurred vision, all of it is so gradual, which is why you get used to it. You might not even realize you have it until you are asked. Another interesting symptom that a lot of people have is something called second sight. Now, for most people, the vision gets worse, the prescription gets higher, but for some people, they get something called second sight, for a little bit of period of time, their vision actually seems better. They need a less strong glasses prescription than they did previously. And that's just because the way that the cataract is reflecting and refracting the light, it needs just a less strong prescription. You just need a weaker glasses prescription. Unfortunately, this effect does not last. It usually lasts about a year or so before the cataract becomes so dense that it truly starts affecting the vision. But that is called second sight, and it's quite common in cataracts. Cataracts usually develop in both eyes, though not typically at the same rate. In the old days, they used to say, is it ripe or not? We don't say that anymore. We just try to find out, how is it affecting your activities? Are you able to read? Are you able to drive? Are you able to recognize your friends across the street? If not, that means it's affecting your activities, and we want to intervene to make your vision better. But those are the things that you're going to look out for. Now, there's 3 different ways you can get cataracts. There are actually layers of the lens that can get affected, and typically each one has slightly different symptoms that it causes. So the first and most common type is when you get a cataract affecting the central part of the lens, causing a clouding there. That's called a nuclear cataract. Usually this is the one that might cause your nearsightedness to get worse, like your distance vision, but it might improve your reading vision initially, giving you that second sight. But with time, the lens becomes denser, more cloudy, more yellow, and it causes that degradation in your vision. This causes an overall worsening in your vision for distance and up close eventually. Now, there's also a type of cataract that affects the outer edges, and it's called cortical cataract, like the spokes on a wheel. These kind of cataracts can primarily be caused by medical conditions like diabetes, or even if you have been on steroids because of other medical problems. These are also the kind of cataracts I tend to see in babies and in children, because the nuclear cataracts come from just a density, from an opaqueness, from all the age-related changes. Obviously, babies' cataracts are a little bit different. They typically have a cortical cataract. If you're an adult with a cortical cataract, you might start to notice more glare. That is one of the most common features of a cortical cataract. It also tends to cause a lot of streaks, and eventually with time, as the cortical cataract gets bigger, the streaks start infringing on your central vision, not just your peripheral. And then another type of cataract is when it is affecting the back part of the lens. This is called a posterior subcapsular cataract, and this is really the one that's most commonly caused by diabetes or steroids, all that high sugar. And usually people have trouble reading initially with a posterior subcapsular cataract. That's because it can be very small, but it's right in the middle of your vision. So it can actually cause a profound decrease in vision, even if it's small. It can cause glare and halos at nighttime and reduces your vision in bright light. These type of cataracts tend to get worse faster than the other 2 types, than the nuclear or cortical. So what are the things that might affect your risk for developing a cataract? Age, diabetes, a lot of exposure to sunlight. So I remember my grandmother had cataract surgery and she was in her late 40s. She grew up in India, near the equator, closer than where we were in North Carolina. A lot of sun exposure, never wore sunglasses. So ultraviolet light can definitely cause cataracts. Smoking, obesity, high blood pressure, previous eye injury or eye surgery, or any kind of inflammation in the eye, something called uveitis, can make you more likely to develop a cataract. Drinking a lot of alcohol and use of steroids. That can be, mainly I'm talking about medication use, but illicit use as well. It can be eye drop form, topical steroids, or even oral steroids, or even nasal spray steroids. So if you're using those for a long period of time, you need to make sure you tell your ophthalmologist about the medicines you're on, because then they're going to be just a little bit more attuned to the development of cataracts. So there you go. Those are some of the signs of cataracts. And again, cataracts are not dangerous. You don't have to have them removed. You can actually keep them in your eyes for the rest of your life. Usually they don't cause such a profound vision loss, especially in the developed world. But in developing countries, they absolutely can. And even in people who have a lot of medical problems like diabetes and steroid use or chemotherapy, radiation, those cataracts can develop quite quickly and can make you lose vision, bordering on the point of actually becoming blind from the cataracts. Cataract surgery is nice and simple. Again, check out the video of my mom's cataract surgery. She gets very nervous, so the fact that she was able to do it, you are awake, is not a problem. But it is not something you have to be concerned about, that you're going to lose vision permanently. Surgery takes about 15 minutes and really can restore your vision back to your pre-40-year-old level, where you can be reading and seeing far away beautifully. If you have questions about cataracts, or if you have cataracts yourself or had cataract surgery, drop that in the comment below. I would love to hear from you. Until next time, I'm Dr. Rupa. Bye for now.